Hi, friend. This is Dr. Apoor Mehra, and with me is our esteemed teacher, Professor Dr. Rakesh Kumar, sir. This topic is basically for the residents, first year residents, second year residents, or third year residents, whether MD or DNB or diploma anesthesia. How and what comes to your mind during residency, and how to solve. So, sir, welcome to this talk, sir.
Thank you.
सर मैंने नीट पीजी क्लियर किया या मैंने INI-CT क्लियर किया एंड आई हैव अ चॉइस टू मेक एंड anesthesia has one of the maximum number of seats in the country
Right.
and I get a seat of anesthesia and during my internship or during my MBBS I have a limited exposure to this branch.
Right.
How do I take a call whether I should take a branch or not? मतलब मुझे कैसे चूज करना चाहिए I can become a good anesthetist?
So first of all, I think what has been lacking, and I always tell the third years when they come to me in my OT for a small stint of 7 days, maybe 3-4 days. The first thing I tell them that whichever branch you are posted in, talk to the residents, look around, what is in it for them. You may get this as your lifetime companion. So what is there in anesthesiology as a career? And some of them then ask me back, sir, you tell me, because you're telling us to do that. So I tell them very simply that this is a beautiful, beautiful career. First of all, the time I picked it up, it was almost looked down upon. To this day, when it has become a huge branch in which there are so many avenues available, both inside the country and outside. One thing you already said, that there are maximum number of seats. That is one thing. But just being more in numbers available doesn't translate into a good career.
True.
So is there a great career waiting for them? So I tell them, yes, there is a great career waiting for them. And I can say with a lot of confidence, because here is a specialty that at the age of nearly 70, my skill level is such that I can handle patients next door. I can manage my brother-in-law at his home. I can give him chemotherapy. I can put IV line. I can manage everything, almost everything, emergency and semi-emergency at home. So my skill set is huge. So one is that part. The other is that you are in demand everywhere. You are in demand everywhere. So the naysayers will say that it's behind the screen job and things like that. It's up to us, we have to learn from people like you, Apu, and other surgeons, to showcase our talent. So once we do that, and I'll share with you that last 20 years of my career, I have spent time in telling my residents how to showcase their talent.
True.
As you said while we were talking, that we are the people who are managing actually the show inside the theater, but we don't show it. We do a very difficult case and we just go out and start having tea. Why can't we tell the surgical team that, yes, this was so difficult, we have managed this, talk to the patient's relatives pre-operatively, post-operatively, who stops us?
True.
It is the inhibition from within. So if we can look at all these areas also, and a lot of onus is on us, the teachers, the the generation next to me, they all owe it to the residents to tell that this is a great specialty. And once we kind of supplement this enough seats and whatever with the kind of beauty of this specialty, then I'm sure that there's no looking back.
Yeah. Saving lives,
Absolutely.
assisting surgeries,
Uh,
getting the surgeries done where the surgeon almost thought it's not possible. Never giving up is something that you should learn from them. I have myself seen as a joint replacement surgeon, if they can devote their time to good blocks, control of pain, our patients end up losing less blood. They end up having less pain and their recovery is very good. As a surgeon, I will always like to say thanks to everybody who has assisted our case as anesthetists, as critical care in the ICU. And you also as a surgeon, right, make it a habit of greeting the anesthetist in charge in the operation theatre right in the morning wish them good luck, wish them good morning, and once your surgery is done, don't just take off your cap, mask, and gown. First, humbly thank them because they are the guys who will handle and spend time with their patient more than you will do in the operation theater. And then that patient is going to sing your song throughout life. So they actually end up deciding how your surgical career goes. And never ever take this lightly. Be very humble to the anesthetist. Listen to their nose. Every anesthetist has an intention to get the surgery done. But if he is warning, I have never ever operated a patient. I work in a private sector. If my HOD anesthesia or a person tells me, Apurv, wait for 2 days. There is no harm in optimizing the patient. You know, we have seen it many times in life. It is better not to go into a car if you think there's some defect. Once you start a defective car, you never know where it goes. Why not to optimize the patient and then take up for surgery? Because remember this statement, a patient has a disease, and with the surgery, you want to cure the disease. The moment you put a knife to it, then the blame will come on to you as a surgeon. And the anesthetist has a better evaluation of the patient than you because they have to give anesthesia and take the patient out. So you need to trust. Similarly, second thing, we as surgeons always feel, let's get the patient out of the ICU. Many a time my anesthesia heads or critical care or ICU heads have told me, hold on, this patient needs more care for day. That's we talked in the last talk. Care is everything in medical science, in life, at your home, everywhere else. So do not take this thing lightly. Beautification of the branch, as anesthetist. If you don't respect yourself, the world will not. If you don't tell what you're doing, how would anybody know? Right? You need to come out and explain to your surgeon and to the community that there was this patient. And that is what the world has to understand. And this is creating positivity in the medical field. So more people take up this branch. I have seen many of the students not taking up anesthesia, leaving a seat and coming next year and compromising with something without even understanding. My grandfather taught me, sir, जो चीज़ छोड़नी है पहले उसके बारे में जान लो फिर छोड़ो जो चीज़ ले रहे हो तो साथ ही चलनी है 50% of your life is your life partner and 50% is your branch.
Absolutely.
Why not to walk to the hospital, spend a day with an anesthetist, talk to him, and many a time your career is streamed. I see people, have glorified certain fields and they'll just take up without even understanding that if you work hard, you can excel in every branch. And anesthesia does not put any limitations to you in any aspect, neither academics or economics. So there is no limitation. True, sir?
Absolutely.
Right.
Totally agree.
Sir, I am doing my residency. I have taken up anesthesia. I am a first year resident. What are the principal advices that you will give me? One, you told me in the last talk, be ready to learn from everybody.
Yes.
This was the advice I was given.
That was the first
Second,
thing.
you told that you used to play for some time and then study.
Absolutely.
So I've got two things from your last talk. Means
Absolutely.
have a balance, and also anesthesia gives you that chance to create that balance.
Yes, I think every field gives you a chance if you are ready for that.
Yeah, true.
We
Na karna aana chahiye.
yes, yes.
Yeah.
So as they say that your hobbies should never be put on back burner.
Yeah.
Because they are the one who take you forward every day. They make you look forward to the next day. So when I was in the operation theater, left alone, sometimes I was cribbing. I'm the only one doing the job and so on. And back of mind was that, okay, 6 o'clock, I have to be on the playground. So, those things are there. But the other thing which you were asking me is that as a first year resident, first of all, I think we must identify who can give what. My co-resident, my senior resident, my consultant, who, and try to get the best out of them. And as they always say in medical field, even the one who's not doing the right thing is telling you what not to do.
True.
So, so don't just think that I want to be with the best. Keep on increasing your experience with various kind of people, various level of intellect, various level of academic excellence, and their hand-eye coordination and so on. and try to learn that, yes, that was great. You can compare also when they are working with all kinds of people, because the
Yes.
residents come back, and as soon as they go from my unit to the other unit, and they start saying that, sir, there this thing is happening, there that thing is happening. So I said, work in with various consultants, all kinds of residents, and all kinds of hospitals also. So whenever you get a chance, go from one where you have done your MD to another place to do your senior residency, to another place to do become a consultant. I think that adds to the knowledge also.
Right. So, if I am a second year, sir, and you have summarized, keep changing the places, but I'm there for 3 years. First year, I should be ready to absorb like a sponge, learn and keep my eyes and ear open from everywhere. Be open to talk to people with different units.
Absolutely.
Respect your seniors. And as they classically say, right, क्या करना है वो ज़रूरी है, but क्या नहीं करना वो भी आना चाहिए.
Even more
So,
important.
why German cars are the best in the world? Because not the speed they escalate to, but because they have the best brakes. They have the best safety. And that is how, what the great leader Abdul Kalam ji said, read the success stories, read the failure ones also, because you will learn more from the failure ones, right? And that is what is more important, because you should be willing to do that. So, first year, go understand, get your foot on the ground. Don't indulge into any quarrels. Be compassionate, have care. Second year postgraduate, how he should go about, sir?
The second year is spent mostly writing a thesis.
Yeah.
So nowadays, what has started happening is that right within 2 months of their joining the first year, they have to submit their protocols and all, which I a little disagree with, for the simple reason that they don't get that feel of that
Branch.
place. Because then choose the right topic, and which area thrills them or interests them more. That doesn't come naturally to people, because as you said, anesthesia you are not aware about as soon till you join as a resident. So let us say that we have found a good topic and whatever. So the second year is mostly building on your skills, and at the same time doing the thesis work and getting the most in terms of how to plan a research, how to conduct a research, how to get the best and how to have the records done properly so that they can be analyzed properly by the statistician. So a department which has a biostatistician is always a great strength, and unfortunately not many departments have that. All India institutes have that. But as you said earlier in the earlier talk, sometimes the limitations also can become your strengths. So you start learning how to do the statistics yourself. You have to go and read the books. So go and read the books. There are tutors available online. There are people who are doing online things. And of course, within your campus, you will find some consultants. He may not be your supervisor. She may not be your supervisor. But you know that he knows more about it. So just go and tell him that you want to learn from that person. And most academicians love to find somebody coming suddenly out of the blue and asking them. They will be more than willing, I feel personally, to kind of guide you. So I think second year should be, one part is that the basics that you have learned in first year, you strengthen them. Try to start doing more difficult cases. Don't shun away that, okay, this is a little difficult case, I'll not go or something. Do give yourself that push that I can do this. Let me find somebody who can guide me into that. And at the same time, look at the journey of your thesis and try to get the best out of that. You may not be doing absolutely original work, but at the same time, but you will learn the art of picking up the right topic, doing the right kind of analysis, recording, and statistical analysis and outcomes, and write a discussion and a good thesis. So second year should be like that only. But at the same time, as I said, don't forget that you want to sing on a karaoke in the evening. Yes, you want to, so keep on doing that. So that is what will keep you going.
Health is
Yes.
mental, social, and physical well-being. So do not leave the mental and the social part, because finally we are human beings. We are not robots, and even the robots needs to be switched off to get the energy back. So what sir is telling you here is, enter, get a grasp, understand what's research and how to go about. Be willing to learn to overcome the limitations. Third year is the main hot game, sir. Exams, the theory and the practicals. DNB more difficult than MDs, right? And so, what's your thought about that, sir? How to go about, how to approach it?
First thing I would like to share with all the residents who are listening is that you are very lucky because there has been a gross change in the pass percentage both in DNB and MD. So that is one.
When I cleared MS you clear, right?
Yes.
I got a medal in that. But when I cleared DNB orthopedics, the pass percentage was 6%.
6%.
I cleared, and the center where I gave my practicals, I was the only one to clear that. I went to Pune. So I can echo with what you're saying, sir.
Yes.
It is very, very difficult.
And it has changed to now 70-80% in
That's huge.
DNBs
That's
and
huge.
almost 95% in MDs.
MS, yeah.
So that is one thing. So exams is another small hurdle which you will all clear. If you are doing, I think whenever I hear a presentation by one of my professor friends and he says, this is for the sake of postgraduates, I hate this line. There is nothing only for postgraduates.
True.
Everything is for everybody. If you are taking care of your patient, you know how to handle that situation. This is fine, baki ho jayega, the exam will happen. And as I said, most likely you are going to get through if you are doing MD or MS, and DNB a little more difficult, but again, very structured now. There are the kind of questions which are there. There are more questions, so more chances of doing it. Just learn to, divide your time. Let us say there are 3-hour paper, 10 questions. Out of that, one is a multiple choice question. So you know that there are 3 hours always had 180 minutes.
True.
And 180 minutes divided by 10 is 18. So my senior resident used to say, 2 minutes सोचने के लिए लगेंगे, think about it, plan your question and answer for 2 minutes, and 10 minutes for writing, and 1 minute for having a cup of tea or a glass of water. So if you have decided that you are going to write only for 10 minutes, then your thoughts are clear. Otherwise, you spend so much time writing one answer which you know very well that you end up messing up the other things. You actually need more time to think about those which you don't know nicely. So if you realize that writing an exam is one part, the other is the Viva examination.
True.
So the Viva examination, again, we know that it has been now divided into multiple tables. So the more the tables, the more the opportunities, the more the questions, the more the chances.
True.
And learn that if you don't know, pass. Let it go. Don't attempt, vague answers. So just learn to say, I don't know, so that the next question can come in. So give yourself as many chances as possible. And of course, again, you are interacting with a human being on the other side also. So you have to read his mind also, or her mind also. So look at them and look at their nuances. And I think you will be fine. You are intelligent people. You understand, that this answer is not going well with the person. So stop and think what is happening, and always spend time listening to the question. People like me have the habit of asking very pointed questions. There are others who will just give you a bottle to describe. So there will be all kinds. The only thing I would say that in third year, find a second year, find a first year and teach that person.
True.
Teach him, teach her. This is endotracheal tube, this is oropharyngeal airway, these are the parts, this is this, blah, blah, blah. When I went into practice, one of my juniors in practice, and he was not a medico, he told me, Doc Saab, wrap up your things and go. Don't go into practice. I said, why? You don't know how to market yourself. You don't know. I said, no, I have done very nice senior residency and everything. So I can, okay, can you talk about yourself for 1 minute, non-stop, without repeating? I said, yes, 60 seconds, no problem. So he caught hold of his watch and he said, okay, your time starts now. And you will not believe I could not go beyond 12 seconds.
Yeah.
So learn to describe yourself, learn to describe equipment, learn to describe procedures, third year. And the best way to do it, learn to present a case. The best way to do is not to find your professors, not to find your senior residents. Find any junior, third year undergraduate, yeah, intern, anybody coming to you. I am going to tell you this. They can't even resist because you are senior.
Yeah.
So you get a great chance to practice your skills. It is just about talking. For me, this job now talking to you all people in front of Apurv is a challenge, because I have never done this. So this is my first time. So please excuse me if
You are
I'm
killing
making
it, sir.
silly.
You are not doing it. You are killing it. But what I understand here is, अगर कोई ना मिले तो दीवार को पढ़ा दो पर पढ़ाओ. As you speak, it becomes better. I happen to been very fortunate to visit Professor Dr. S.M. Tuli sir, and I went to his home on Sunday. It was a Sunday evening. What was he doing? He was studying alone in his room at the age of 93.
Absolutely.
So he was studying. So I think be ready to teach, because that's the best way to learn. That's what his career describes, He started giving it back. Arnold Schwarzenegger has taken a beautiful thing, 6 ways of living life. His 6th point is give back to the society. So if you can give back and teach to your juniors, not only you're improving your concepts, you're giving something to them, you're stimulating them. वो भी तो जाके पढ़ेगा ना, कुछ तो बोलोगे आप ऐसा. तो बेसिकली आप पूरे का पूरा पॉजिटिविटी क्रिएट कर रहे हो, rather than sticking onto social media, onto your phones, or talking about things that have happened. It is better to talk about your academics and improvement. Javed Akhtar has written a very beautiful book. He says there are 3 kind of people. One is somebody who talks about human beings. वो लोग अगर इसने वो गलती कर दी, उसने वो गलती कर दी, आज वो नहीं आया, एक वो नहीं आया. That is the first, the lowest level of human beings. The second is they talk about event. अरे देख वहाँ क्या हो गया, अरे देख वो क्या हो गया. And the third is to talk about ideas. The people who talk about ideas and vision are the highest category. So talk about your ideas. Talk about medical science. Every textbook, it has about, there was an RCT and this was the result. The lines are summaries of the researches. अगर रिसर्च नहीं होता, राइट, आज बुक्स ही नहीं बनती. 10-10 साल की रिसर्च एक टेक्स्ट बुक की लाइन बनती है ना सर.
Absolutely.
That's how it goes. And my last question, sir. I have done MD anesthesia. What are the options I have for me? क्या क्या कर सकता हूँ मैं? Means I can go for a fellowship.
Absolutely.
I can go for an SRship. What all other subdivisions I can go into, like pain, critical care, what all?
Absolutely innumerable now.
Tell me, sir, few of them.
First of all, the senior residency versus fellowship.
Yeah.
If you are planning to go into academics, senior residency is a must, because that is a requirement. Otherwise, when it comes to your career and doing further, it doesn't matter. Getting more and more experience is always welcome as a fellow or as a SR.
Good.
But as far as the scope is concerned, now the scope is that you go into pain medicine, which is a totally independent branch.
So let me come back. Pain specialist is running an OPD.
OPD.
Doing procedures.
Procedures, having a small setup where there is a daycare available till the evening and they leave it. Or you can go into palliation.
Okay.
Palliation itself, then onco anesthesia with palliation, which is the branch available. Then pediatric anesthesia, cardiac anesthesia, and neuro anesthesia. They are all within the operation theaters. But outside the operation theater, pain clinic and intensive care is mostly manned by people from anesthesia background, and they're doing extremely well. So that again gives you a face-to-face interaction with the patient. These 2 areas, pain medication as well as intensive care. If you want that, I want to personally interact. I like that the surgical colleagues are interacting with the patient. I am behind the screen. So these are the places where you can branch in. And of course, the emergency medicine is also being grandfathered by most anesthetists at many places. So emergency medicine is a very budding branch in our country. USA, it is about 52 years now, because my elder son is doing ER. He is an emergency physician in the US. So again, I feel the only other branch which has more skill set than anesthesia is the emergency medicine.
True.
So these are, you can always get into that. If you want to go outside and branch into emergency medicine, this will become a great ground on which you will be standing right from the beginning. So I think there is huge set of opportunities waiting for us.
Fantastic, sir. And now some rapid fires from sir. Sir, your favorite academic book during MBBS?
During MBBS, okay, I liked the Grey's Anatomy.
First year, Grey's Anatomy?
Yeah,
Yeah,
I started liking it much later, of course, but when I realized what was the practical aspects of it, you know.
Not many audience will love the answer, but for myself, I love Robbins. And Grays and Robbins are not so much read in today's world, but
Yeah,
still,
they've all gone.
these are beautiful books. Your favorite non-academic book?
Non-academic book, Rag Darbari.
Okay. Your favorite actor?
Favorite actor was always Raj Kapoor.
Your favorite movie?
Favorite movie again, Shri 420.
Right. So, sir, when I look at the career streaming of people staying in India and developing their roots the way you have done it, yeah, and you have created your own legacy in Airway and the life support, right? Which is your favorite place in India which you love to travel?
I loved going to this Hemkund Sahab and Valley of Flowers. I've been twice and I loved that place. I would love to go again.
You
So,
surely
I've
would,
never
sir.
been to Northeast, like unfortunately the Tawang Valley and all. That is also on the list. But the ones which I have seen out of that, I think Leh and Valley of Flowers, and
And do you agree, sir, traveling educates you?
absolutely great education.
Traveling abroad, which is your favorite place abroad?
I loved Iceland the most because I drove for 8 days on the ring road of Iceland, and again forced by my children to go alone with my wife, not with a group. I think
That's a memory.
at the age we went, it was adventurous and it was very exciting. I loved, and it's a beautiful place to be.
Apart from your parents, if you have to name a person who has the biggest impact in your career,
Undoubtedly, my wife.
your wife,
Alka.
and in academician, the teacher,
Teacher, there have been many actually.
there is no harm in open, sir. This is a teacher-driven platform.
Absolutely.
Whatever names you want to take, we are open to it. Who is your first teacher you remember most fondly?
Most fondly, I can begin with a class 5 teacher, Mr. Kishan Dev, because he showed a lot of faith in me and he said that you can do anything. So that was a great thing to happen. Of course, you have already named the parents. So then came the English teacher in higher secondary because we did class 11.
Right.
So the chemistry / mathematics teacher, Mr. Mishra, who was available always. I could catch him on the way and ask him, "Sir, I don't understand this question." He'll sit down there itself, and the wooden the thing of the staircase, he would always have a chalk in his pocket, and he'll start
Start
solving
teaching.
there. And then, of course, the English teacher who said that speak the right language in the right manner. And he was very funny and he could go on and on in all directions and made everything so interesting. So I think whenever I try to teach, I kind of try to imbibe all these people along with my father, who was a great teacher again, and my eldest brother, who were great mathematics teachers. But other than these were the people in the school level who really thrilled me. And in the anesthesia, as I said, I was thrilled to see Dr. H.P. Verma, because he was the one who, in a fourth year class, told me how to interact with young people when they ask embarrassing questions. He taught me how to bring up my children, because he gave us an example when the kids will ask very embarrassing question. And so he told me that with an example, that you must not lie to them because they feel that their father and mother are the most truthful people. And if they find out later on that you are not, and you have been, sidelining the questions which they had asked, then they would lose respect. So I followed that principle. So Dr. H.P. Verma, Dr. Mrs. Mittal, Dr. Raminder Sehgal, I would say, and Dr. Datta, who was my supervisor. The one thing which they taught was inside the theater, inside the place of work, they were very strict and very standardized. Outside, they were very friendly. So they would, as soon as we came out of the workplace, चल यार तेरे को पिज्जा खिलाते हैं, चल यार let us have a session of songs and this and that. So that is what I got from them.
ब्यूटिफुल. सो नमन है सर जो आपने बोला. डॉक्टर कृष्ण देव सर ने हमें ये सिखाया, राइट, कि वेन एवर अ टीचर इज़ देयर, द इम्पैक्ट ऑफ अ टीचर इज़ लाइफ लॉन्ग. ही वॉज अ वेरी यंग स्टूडेंट, बट क्लासिकल सेइंग है, जाकिर खान कहता है, आपके जीवन में आपको कोई कहने वाला होना चाहिए, तू कर सकता है. सो हिम्मत दी, टीचर को हिम्मत देनी चाहिए. टीचर एक अध्यापक, उसका इम्पैक्ट आपकी लाइफ में हमेशा रहेगा. डॉक्टर मिश्रा ने सिखाया, जो साथ खड़ा वो सबसे बड़ा. वो समय दे रहे हैं ना, आपके पास डाउट है, वो सॉल्व करने को तैयार है, चौक जेब में है. सो अगर आप एक टीचर हैं, आप एक मेंटोर हैं, अगर अपने स्टूडेंट्स को टाइम ही नहीं दे रहे, आप उस नाम का क्या करेंगे? आप वन डे यूल गो. What is remaining is what you have created. So try to leave the next generation with what you have understood. Knowledge तो वही है ना. दो माँ हैं, एक लक्ष्मी माँ, एक सरस्वती माँ. दोनों की इज्जत कैसे करते हैं? लक्ष्मी माँ को बचा के रखो, सरस्वती माँ को बांटते जाओ, तभी बढ़ेगी. सो रेडी टू सॉल्व द क्वेश्चन. एंड देन डॉक्टर वर्मा, सुष्मिता सेन की एक लाइन है, आपसे कोई भी क्वेश्चन कितना भी बदतमीज़ी से पूछा जाए, आपका जवाब हमेशा अच्छा होना चाहिए, क्योंकि दुनिया सवाल नहीं जवाब याद रखती. दैट इज़ वॉट ही सेड, कि आपको ठीक से आंसर करना है, क्वेश्चन कोई भी हो. एंड दैट इज़ वॉट ही इज़ बीन अ प्रोफेसर, ही इज़ बीन अ फादर एंड ही इज़ बीन अ हस्बैंड. ही इज़ आंसरेबल टू एवरीबडी and he has to take care that his answers are appropriate, and that's the way to run a system, a department, and work at your home. And and summarize, कहते हैं कि beautiful, at the end of the day after teaching, they are all going and enjoying and having a good time. क्योंकि राजा और प्यादा चेस के गेम के बाद एक ही डब्बे में बंद होते हैं. राइट सर?
Correct.
So this is all. Thank you very much for this talk. Thank you, sir.
Thank you, Apu.